Is your voice hoarse? Maybe you sound hoarse after a long day of talking, and maybe you wake up with a hoarse voice every morning, or maybe you sound hoarse all the time. In this video, I am sharing 5 most common reasons for hoarseness, together with some tips on how to start dealing with your vocal problem. Hi, I am Katarina, speech-language pathologist, and here on this channel I share practical tips about using your voice in a healthy way. So if this is a topic that interests you, consider subscribing to this channel and hitting that bell notification icon so that you don't miss any of my future videos. First of all, what does it mean to have a hoarse voice? It simply means that you sound raspy, breathy, or strained. When there is disruption in the structure of the vocal folds or the vocal function, your voice cannot work properly. Maybe the vocal folds don't come together completely, or there is too much compression. Maybe the tissue of the vocal folds is swollen, or the vibrations of the vocal folds are somehow disrupted. Hoarseness is a general term, and there may be many different reasons why you sound hoarse. So just based on how you sound, voice specialists cannot really determine what is going on with your voice and how to help you. I often get asked here on YouTube and other social media platforms to listen to a short audio sample and make a diagnosis or suggest next steps. It's not possible. The process of figuring out what vocal issues someone is dealing with and what the next steps should be requires more than listening to someone's voice. Nobody can tell by just listening to your voice. Now let's talk about 5 common causes of chronic hoarseness. Chronic means a hoarse voice that persists beyond 2 weeks without the presence of acute infection, such as common cold or flu, or often comes back after voice use. So here we go. Cause number 1, medical conditions and medication. Medical conditions such as allergies, asthma, acid reflux, hormonal changes, arthritis, stroke, Parkinson's disease, and many other conditions can cause hoarseness. Also, some medication is known to cause a hoarse voice. The best way to deal with hoarseness in this case is to consult your doctor or a medical specialist such as an allergologist, gastroenterologist, or neurologist. The main goal is to manage the underlying medical cause, and the secondary goal is to minimize adverse effects on your voice. In some instances, you can be working with a voice therapist to optimize the vocal function or maximize vocal health habits. This can be a challenging process that requires a delicate balance between these 2 goals. Cause number 2, vocal overuse. Hoarseness due to vocal overuse happens when vocal folds work more than they are conditioned to at that moment. People who use their voices frequently with great demands are prone to vocal issues. Also, if you use your voice in a way that brings the vocal folds together with greater force, you may be experiencing hoarseness. For example, if you push your voice to increase loudness, if you engage muscles unnecessarily, you may be asking your voice to work beyond what it can handle right now. If you belong to this category of people, I suggest 2 things. First, plan your voice use and voice breaks ahead of time. Know when and how you will be using your voice throughout the day and week, and make sure that your voice has a chance to rest and recover. Second, build vocal and body endurance and stamina with the regular practice. Keep improving your vocal technique to optimize vocal function for high demands. Cause number 3, muscle tension. If you've seen my videos before, you know that I work with people who experience vocal tension or strain, and hoarseness of voice is a very common symptom of muscle tension related vocal issues. Just imagine your muscles are working with excessive tension. Maybe the vocal folds come together with greater force, or other structures in the larynx squeeze or compress. which causes irregular vibrations. Or maybe there is a little gap between the vocal folds and the muscles over squeeze to produce a clear tone. This is a functional problem. There are no structural changes on the vocal folds themselves, but the coordination of the muscles responsible for voicing is out of sync. In this case, releasing tension, improving breath flow and resonance, and optimizing vocal function without inviting tension into the picture help get rid of hoarseness. If you are experiencing vocal strain, tension, or even pain when speaking, and you are ready to work with me towards a free, strong, and confident voice, you can apply to our Vocal Freedom System coaching program. Check out the links in the description below this video. Cause number 4, smoking tobacco or marijuana. It is well documented in many scientific studies that smoking tobacco causes changes in the structure of your vocal folds, including their thickening or even cancer. These days, it is more and more acceptable to use recreational drugs such as marijuana, and some people are wondering if smoking of marijuana affects their voice. There is no doubt that smoking has a negative effect on the vocal folds, whether you smoke tobacco or marijuana. There may be less damage to the voice with a vaporizer, but there is still a possibility of injury like hoarseness, limited vocal range, polyps, or nodules. A risk of cancer also exists regardless of method of inhalation, and this damage is usually irreversible. Cause number 5, paralysis. Vocal fold paralysis occurs when the nerve impulses to the larynx are disrupted for whatever reason, and very often we don't know what the reason is. We just know that one or both vocal folds do not move properly. Vocal fold paralysis can result from surgery, injury to the chest or neck, cancer, neurological disorders, or something else. Therapy for vocal fold paralysis will be very different from the other 4 causes, so it's very important to really know the reason behind your hoarseness. If you experience recurrent hoarseness or if your voice is chronically hoarse, the first step is to speak to a voice specialist, more specifically a laryngologist, and have your voice properly evaluated. As you can see, there are many different causes of hoarseness and they are all dealt with very differently, so make sure you take the first step. If you are dealing with excessive tension that may be causing hoarseness, I also made a video in which I walk you through 7 steps that lead to a strong voice without tension. If you want to know what body, voice, and mind factors you need to consider to finally free your voice, click the link in the description below this video. If you found this video helpful, click the like button and share it with your friends. And check out my other videos right here below, and I'll see you soon. Bye!